So we're going to get started here shortly. It looks like there's still people filtering in. So my name is Dr. Emily Vardell, and I'm an assistant professor here at SLIM, and I'm really excited to be talking with you all today about health insurance literacy in libraries. And thanks also to those who are watching the recording in the future. So what I'm going to be talking about today is a little bit about what health insurance literacy is, but we'll spend most of our time talking about tips and tricks that you can use to provide reference and outreach services relating to health insurance in your library. So what do I mean when I say health insurance literacy? So this is probably the best known definition. It was published back in 2013, and it includes things like the extent to which consumers can make informed purchase and use decisions. So it's not only picking a health insurance, but also once you have it, how do you use it? And then it also looks at the knowledge, ability, and confidence. So we'll be looking at strategies and also resources that can help with both pieces of this, both choosing health insurance and then also using health insurance. So things that include, that kind of fall under the umbrella of health insurance literacy are things you might not necessarily expect, like how to find a physician, how to fill a prescription, use and pay for medications, use a health savings account. If you have one of these, you know it can be confusing. Sometimes you have to submit receipts to get reimbursed. They're making it easier now. A lot of places have a kind of credit card that you can use, but it can be challenging to figure out how to use one of those. And then also preventive services like mammograms and an annual physical that are currently available for free through health insurance coverage. So when we look at health insurance literacy, there's a connection with health disparities. So these populations on the screen here both tend to have lower levels of health insurance literacy according to the research, and they also have larger health disparities. So people like seniors, minorities, people who are do not speak English as their first language, people with lower socioeconomic levels, lower health status, lower levels of education, younger Americans who are signing up for health insurance for the first time, and the uninsured. So there's a real connection and an opportunity here to address health insurance literacy issues and hopefully also improve health outcomes, because the research has shown when people are covered with health insurance, they have better health outcomes. They tend to be healthier people because they're getting those preventive services. They're seeing the doctor instead of waiting to go to the emergency room and that kind of thing. So whenever it comes time to look for health insurance data, this is one of my favorite places to go. It's the Kaiser Family Foundation, kff.org. And it's a really great source, as you can see, for all kinds of health-related data, not just health insurance, although I've got a little arrow there to show you where you can find that, but it has other things as well that can help you figure out what's going on in your community. So when we look at uninsured population by state, these would be people who don't have health insurance. You can see where your state is here. I think most of us are probably in Kansas, but not all, because we have our cohorts across the country. You can see where your in different states would fall in terms of the uninsured population and who we might be helping get signed up for health insurance for the first time. If you want to look specifically at Kansas, this is kind of how the breakdown falls in terms of where people get their health insurance. And this is pretty typical for most places. Most people get their health insurance through their employer. Over 150 million people a year get health insurance through their employer. That's by far the most common way that people get health insurance. But here's a couple of other ways, things like Medicare for people that are 65 and older, Medicaid, especially for women and children, and then the uninsured and the non-group, which is kind of where the people who sign up through the marketplace, through the health insurance marketplace and the Affordable Care Act would fall. So where do libraries fit in this? Why should libraries care? Why should they do anything? So it actually dates back to the 2013 ALA conference. President Obama actually requested assistance from librarians in helping to implement the Affordable Care Act. And the IMLS kind of picked up on this and said it was really an ethical mandate rather than a government regulation to help with this. So this is kind of when it started to become more and more important for librarians to think about how they could get involved in this area. And this specifically is looking at the Affordable Care Act, but it's much bigger than that, as you just saw in one of the previous slides. So many people get their insurance through their employer, and they may also need help figuring out how to use it. It's a confusing thing. So one of the things that I wanted to talk about today is this funding that the Public Library Association offered. So this funding actually came out of a deduction in federal spending on promoting healthcare.gov and signing up through the health insurance marketplace. So for like the last 2-3 years, the federal government has really cut a lot of the advertising on TV, through social media, things like that, to remind people to sign up for health insurance. So PLA identified an opportunity for librarians to help fill in this gap, to help people, as it shows in the bold part, obtain non-biased, trustworthy, and authoritative information about health insurance options. And so they offered small grants to public librarians 3 years in a row to help with this, fill this need basically. And one of the things I'm going to be talking about today is my graduate assistant, Ting Wong, who's a PhD student here at SLIM, and I conducted some interviews with people who received this funding. And so I'm going to talk today about how they use that money, what they found to be helpful, some strategies, some of their favorite resources. And the funding that they got was somewhat minimal. It was $500, what they called mini grants. So the ideas that I'll talk about today don't cost a lot of money, but have shown to be effective in providing this much needed information. So when we look at who is signing up for the health insurance marketplace, it kind of reached the height in 2016, and it's dropped off a little bit, maybe because of that reduction in funding to promote the health insurance marketplace and remind people to sign up. But as you can see, it's not as big of a drop as they were worried that it might be. So maybe with librarians fitting in here and providing some assistance, that might have been part of the reason why there was less of a gap, that librarians and obviously other partners and community organizations stepped up to fill in that gap and remind people that it was important to sign up for their health insurance. So again, what I'll be talking about today, I'm going to share a little bit about those interviews with librarians who undertook outreach efforts in this area. I'm also going to talk about some concrete strategies that you can undertake at your library for health insurance outreach efforts. And then I'll share some favorite health insurance information resources. That's always a popular one with librarians. So I hope that you'll take away some ideas of some tips and tricks in terms of strategies, but also some resources that have been vetted that are good places to go for information about health insurance. So we'll start again with those results from the interviews. So one of the things that came out when talking with the librarians is why are people doing this? And people talked about a lack of awareness. One of the participants said, I think people didn't even know it still existed, that being the health insurance marketplace, the Affordable Care Act, signing up through health insurance that way, or what the deadlines were because the government wasn't promoting anymore. And that connects to what I was talking about before, that there was reduced funding for promoting this. You can see that on the right, a brief from September 2018 when they started doing this. So the people that I talked to saw that there was a lack of awareness, and that is why there was a need to fill in this gap. And just to kind of go up with the deadlines the deadline is, the open enrollment period is going on right now through December 15. So it's a perfect time to be talking about these issues and thinking about ways to promote this information in our libraries. People also talked about a lack of understanding. Why should we do outreach in this area? People are looking for information on this topic. So one participant said they get a lot of phone calls at their library, people looking for information like, when is the deadline? Did I miss something? Who can I talk to? And they even talked about bigger than health insurance, other health topics, like you're having a nurse coming to talk about diabetes. Can you help me learn more? So this lack of understanding is a reason for libraries to get involved. It's demonstrating an information need that we can help meet. So then I also talked to librarians about what they were using this money for. And as I mentioned, they were mini grants, so not a whole lot of money, but it is a little bit of money. What did they use them for? And one of the really common methods that people used it for was boosting social media. So one person said, we shouldn't be afraid to go ahead and boost the post, even though it costs money. This person was in a rural library. She was a little bit worried about using the money this way, but it was successful and they saw success with that. And one person, which I thought was interesting, talked about using this sort of as a test for the census, because I talked to these people in like February and March of this year prior to the census. And so they were saying, okay, we're going to boost this post about health insurance, see how it goes. And then if it's successful, we'll try it with the census. So something interesting to consider right now, again, is a good time to boost post, remind people that it's time to sign up for health insurance through the Affordable Care Act, through Health Insurance Marketplace. And you can test it and say, okay, well, this worked, so I can try it again for this other project the library is going to do. People also use these funds to hold events, and you might have held similar events at your library. A very common one was enrollment events, where you might bring in navigators, so trained individuals who can help people sign up for health insurance, bring them in and have a place where people can come physically when it was safe to have in-person programming in libraries, have people come in and get assistance one-on-one from the navigators. And you can see the person that I talked to here tried to pick a variety of times, like the evenings and the weekends, because that's when the events in general are most popular, when people can attend. And then one person that we talked to took a fairly unusual approach and decided to hold an event where they screened the film Soul Food Junkies that talks about particular cuisine popular in America, showed that, and because they thought, as this person said, health insurance isn't the most exciting, which this is why I'm glad so many of you are here at the webinar, because not everybody likes to talk about this. So what they did is they showed the Soul Food Junkies movie as a way to talk about health, talk about food, talk about nutrition, and then kind of grab people in and then talk about health insurance. And it was very popular. They had good attendance. So I thought that was a kind of creative and an unusual way to get people interested in this topic and get people talking about important issues in their communities. Another really popular method, and this is something libraries have done for all kinds of outreach and programming, are things like flyers and posters. That's a sample one there on the right. So here are some examples of where people created it and why, what kind of information they shared, like, did you know it's enrollment time? And they distribute it in a variety of different places, companies, public places, senior centers, churches, restaurants, schools, etc. And then depending on their communities, many also used English, Spanish bilingual flyers to extend the audience that they were reaching out to. And one thing that really stuck out from several people that we talked to is that people are surprised that libraries are involved in this. It's not necessarily something people associate with libraries. They don't think of it as a place to get this kind of help sometimes, especially, as this person said, in smaller libraries and rural libraries. But they've got the connections to help get this going. And as this person said, it's a novelty to kind of bring in people. So it's a way to spark some ideas, spark some interest, and say, hey, the library provides outreach and services in this area. We can do other exciting and cool things that you might not expect as well. So it's a way to open up the way people think about the kinds of things that libraries can do. And then many people we talked to spoke about the impact of this. And when I asked people, you know, was this outreach successful? Many people said, well, to be honest, the number of people who attended was lower than we'd hoped or that we'd expected. But as this person here says, even if you're only able to give a little thing, help one person, just help a couple of people, it's a lot better than nothing. And they really felt like there was an impact, and maybe the numbers weren't huge, but the people that were there were really grateful for the help. And then as a second person said, as I was hinting at with the last slide, it becomes a part of the mindset in the community about the services that you offer. So again, expanding what people think the library can do. And as they become to realize, oh yeah, libraries can offer this kind of help, then we might see more numbers that kind of meet those expectations of how many people we think might want this help. So now that I've had an opportunity to talk to you about some of those results of the way people use their funding and some of the findings, things that came out of those conversations, I also want to share some of the concrete strategies that they mentioned for undertaking health insurance efforts. And here's where I would love to hear from you all in the chat if any of this rings true to what you've done, or if you have similar ideas too. So I'll have a couple of questions, but feel free to add that into the chat as well. So one strategy that I thought was really unusual, but really smart and innovative was this person created those flyers and posters, and then she took them to the human resource reps from companies in her area. So she would basically go to the company in her neighborhood, ask if the HR person was available, and then did a quick 5-minute kind of elevator talk saying, this is this cool thing we're doing, and just letting them know this is what libraries are doing. Can you please now hang up this poster in your break room, in the lunch space, whatever might be appropriate for that particular company. But it was a way of getting out of the library and marketing, I think in a fairly unusual way, connecting to companies that are out there and creating some relationships with the community. And you might be thinking, well, why is she doing this in companies? People can get their health insurance from companies. Well, not everyone gets health insurance from their employers. Some people only work part-time, or their companies are so small they can't offer health insurance. So it is very possible that people might need to look for health insurance outside of their employer if it doesn't apply to their particular situation. But it's just, again, a great way to get out into the community and reach out in, I think, a fairly unusual way. A big piece was collaboration. This is something libraries tend to be really good at and focus a lot of attention on. So people talked about local organizations and partnering with them, like getting a discounted price on printing those posters or flyers. And just the community is a great resource to turn to. And as I mentioned, reaching out to navigators was really popular. So these are people trained to provide health insurance assistance, especially signing up through the health insurance marketplace. So you can bring those people into the library. They can help out as many people as they can, but here was an example of someone who made an appointment with the navigator at her office later on. Then she came back this patron came back and said that that navigator was incredibly helpful. So that's another connection that libraries can help facilitate, kind of be the intermediate between the patron and the people who can offer this one-on-one assistance. So this is where I'd love to hear from you all in the chat. If you can think of natural partners in your community that would make sense to work with in doing health insurance outreach, in meeting health insurance literacy needs. These are some ideas I have, but I would love to hear from you all if you have thoughts on who might be a good partner in your community. Great, so John wrote senior centers, definitely excellent. So that is a big piece when thinking about signing up for Medicare and all the different parts that are involved in Medicare. And that's another issue because there's so many options available in Medicare, just hundreds of different pieces to choose from. And so that's another great resource to partner with. Please feel free if you have other ideas. Yeah, so Michaela said, service club presentations like the Rotary, Kiwanis, the Lions Club, excellent. Also great idea. Social service organizations, food banks, great, Tina, thank you. Homeless shelters from Jenny, definitely. Great, and Hazlet says, a student group at KU serves as my library's healthcare navigators. Awesome, yeah, they might be master's students, so there's probably people trained that can help with great, signing up for health insurance at the library. Yeah, Christina says public schools could boost the message to parents and community members. Certainly. Yes, this is, again, kind of bringing awareness. You don't have to be the one helping them sign up, but just saying, hey, it is time to sign up. Now is the time. And when I show you some resources, I'll also show you some resources for helping understand how it works. So that could also be things that you could promote for parents and community members, and even staff inside of the school, inside of the institution where you work, might benefit from some of this information as well. Thanks, Christina. That's a great viewpoint. Two-on-one services where those are available, says Tina. Yes. And Myra says, looking for individuals in the community who have the skills and are willing to volunteer. Yes. So knowing, it's great to know who specifically can I connect individuals to. And then Margie says PSA on social media channels, for sure. And I'll show you, if you're kind of overwhelmed, like what would I potentially start with posting in social media? I need some ideas. There's actually places you can go that have templates that you just customize for your library, and then you can use those in social media. So I'll show you what those look like. These are great ideas. Thank you so much, everyone, for adding to the chat. Tina writes, adult education and literacy groups. Definitely a great resource to partner with. And of course, and Grace writes, schools and college open houses, definitely, yeah. And of course, so many of these are not health insurance limited. I think almost all of them are great partners for libraries generally. So when we get these relationships established, then we can just build on them for other library activities as well. Or conversely, if you've already built on them for other activities, now you can say, okay, we already have these natural partners in place. We've been working with them for years. Now let's tie in the health insurance piece. Please feel free to keep adding ideas. We've got some really good conversations going in the chat. I appreciate your participation there. So one thing that might be a little overwhelming when thinking about offering health insurance assistance at your library is, how do I answer a question at the reference desk? A lot of people are very concerned about offering health information assistance at the reference desk. It can be definitely intimidating, but this person took a nice approach. It's like, she says, it's like guiding people like a tax filing. I'm not going to do it for them. I show them where to go, how to do it, where to do it. I thought that's a really helpful analogy, I think, in that you're not going to have to sit down and help someone sign up for the health insurance. Just like you would for when it's tax season at the library, you can point them to the forms, point them to where to do it online, you know, how to go about the system, but you don't sit there and pick it out for them, fill out the forms for them, that kind of thing. So again, we don't want to offer advice, just like we wouldn't offer medical advice, but we can point people to the right places and point them to the helpful assistance, authoritative assistance, non-biased assistance. And then, as I was mentioning, you know, some of what we've been talking about so far is a lot about the enrolling, but there's also the using health insurance piece. So knowing, this person says, knowing the information and understanding why are very different things. So how to use health insurance coverage versus where to go and get it right. Why should I bother to get it? Why should I be proactive? I think those are really great conversations to have. Many people just may not have traditionally had health insurance, so they may not understand why bother with it? Why is it important? And then now that I have to have it, or now that I do have it, what do I do with it? Do I just wait until I'm sick? But you can instead say, hey, now you can go and get an annual physical for free. So giving some information about how to be proactive and use the health insurance to promote preventative care, staying healthy. Hopefully that will lead to a healthier society if people are using some of these preventive coverage that's included in health insurance. So I also talked to people about, okay, you've got this little mini grant, what would you do differently in the future? And here are some things that people shared. Many people said they wish they had started on health insurance programming earlier in the year. I know this is such an unusual year, so you may feel like there's very little that I can do this year. Well, you can then think about, okay, I'm thinking about it now, and so I'm going to make plans for next year. We're going to sow the seeds and then start across the year doing some things earlier, not waiting until exactly the enrollment deadline. That could be something to consider. Also providing more general health programs in libraries, so bringing in nurses in your community, people who work in healthcare clinics in your community, to come in and offer, okay, here's a seminar on diabetes, here's a seminar on high blood pressure, whatever would be relevant in your community, bringing in people for that. And then the conversations can also include health insurance in almost all those discussions. Reaching out to more patrons before the program by requesting registration ahead of time. That would be specifically for events, if you want to hold events, especially enrollment events, because they're so one-on-one focused. A navigator can really only help one person at a time. This person that mentioned this talked about needing to request registration ahead of time. Right now, that's pretty much how all libraries work. If you're going to have an appointment in the library, you got to request it ahead of time because we have limited number of people who can be in our libraries, but that could be generally a good idea for doing this kind of programming. People also talked about partnering with other local libraries so we can share resources, share ideas. Here, inviting nurses, hospital personnel, and government officials to present about the Affordable Care Act or health insurance in general during enrollment events. And then a couple of people talked about using project outcome to measure the effectiveness of the program. And I'll talk in a minute about what that is if you haven't heard about that before, but it's always important to evaluate the efforts that we're doing and figure out, okay, what could we do differently next time? What's working really well so we can continue doing that? Always good to measure the effectiveness of the outreach that we're undertaking. So I also wanted to mention, I'm really thrilled that Ting and I wrote an article about these interviews that we conducted with librarians, and it just came out in Public Library Quarterly like last week. I think it was published November 9th online. So if you are interested in learning more about some of these findings, some of these tips and tricks that I was sharing, if you look at Public Library Quarterly and search health insurance, this should come up. It hasn't been printed in one of the print versions yet, but it is available online. So if you have access to that, that's great. If you don't, feel free to send me an email and I can work with you about getting you access to this article if you're interested in learning more about this. So now I'm going to turn to talking about one of librarians' favorite things, information resources. So this will be websites that will be helpful for you in providing authoritative, non-biased information about health insurance. And if there are ones that I don't mention, I'd love to hear if there are others that come to your mind. I'm always excited about learning about more resources that can be shared on this topic. So when I ask people what their favorite resource is, this one comes up frequently, which makes sense. Healthcare.gov, that is the place, the only place to sign up for health insurance through the Affordable Care Act. I will say we'll continue to see how this evolves and changes over time. As many of you, or not all of you probably know, this is under review in the Supreme Court now. So we'll see how if things change. People will still need health insurance, even if healthcare.gov changes in some way. I think our conversations are still relevant, but just wanted to put that caveat in there. And I will also say that the information resources in healthcare.gov have also evolved over time. When it first came out, it had like a really helpful timeline about here's how it's going to roll out, and it had specific pages for particular population groups, had some resources for definitions and things like that. Some of the really helpful resources in here have been removed over the last few years. So some of the like tangential information, like a timeline of the Affordable Care Act, that's not here on this website anymore. So I just have to put that in there, that some of the resources that used to be really helpful in healthcare.gov aren't there, but it is still the place that you go to sign up. As I mentioned before, there are templates that you can use if you're going to print flyers or posters, you're going to promote stuff on social media. You do not have to reinvent the wheel. PLA is there for you, and they have made, these are all 8.5 by 11 poster type things, but they also have social media templates that you can use. So you can just open up one of these, put in your library's information at the bottom. like, put your logo, put your phone number, put your hours, whatever makes sense. So that's a really helpful resource. I've included some links here, and I will share a link to the slideshow later. But if you also want to email me for links, I'm happy to hook you up with those as well. But this is a great place to go. If you just look at the Promoting Healthy Communities, Libraries Connecting You to Coverage page on PLA, they have hyperlinked all of these template flyers and posters that they have available that you can customize for your library. And this is in general a really helpful source, that Libraries Connecting You to Coverage page. They have kind of intended to make it one of those one-stop shop kind of places where they pulled a lot of resources together. So it's a really helpful page to check out. And again, super helpful for finding templates that you can customize for your library. Another one that came up when I was talking to people during this study was Young Invincibles, which I had not heard of prior to talking with people in this group. And this is a resource that was designed for a younger audience, as the name suggests, Young Invincibles. But I think a lot of the resources are fairly universal. The one on this kind of screenshot on the right is their preventive care page. And as you can see, it is very clear and not necessarily has to be for a younger audience. This page in particular walks through screening tests versus diagnostic tests and why you'd need to get them, an example, that kind of thing. So really helpful information that breaks it down into easy to understand language. And so they have things like time for a checkup. That second link is that same time for a checkup, but in Spanish. They also have resources on the special enrollment period. So that's for people who have what they say, like life-changing circumstances over the year. We have a general enrollment period going on right now, but if you lose your job, if you get married, if you have a baby, things like that, you kind of have special circumstances, so you can sign up outside of the enrollment period. And so that's what that special enrollment period handout would be. So if you have someone at the library who mentions something like that they know they are under a special consideration, that might be a helpful handout. And then just some fact sheets. That one is particularly on how millennials use and access healthcare. And so, as you might guess, that one's specifically with a younger audience in mind. But again, what exactly is preventive care is more universal. So I'd recommend checking this one out for helpful handouts that walk through what health insurance looks like. And then, as I was mentioning a couple slides ago, Project Outcome is all about helping make measurement and evaluation easier for libraries. And this screenshot here at the bottom says, over 280,000 public library surveys have been created and collected through Project Outcome. Over 1,600 public libraries have created surveys with this tool. So if you haven't used this before, I'd highly recommend checking it out. And they most recently created a Project Outcome for academic libraries. You can see that in the orange bar at the top of the screenshot. So if you're in an academic library, there is one that's specifically for that audience too. And so I think this makes it really easy to evaluate the services that libraries are using. So you don't have to be a survey expert. You can just use the simple surveys and easy to use process that they have built into Project Outcome for evaluating what you're doing at your library. And I see Margie wrote, Project Outcome is wonderful. Yeah, thanks for putting in another plug. This is a great resource to turn to make it easier to do the evaluation that we want to do in our libraries. And then this resource is one that I just found out very recently, but I think it's super fun. It's called Ensuring Good Health. It was developed by the University of Michigan, and they use this superhero idea to talk about health insurance. So it's a little more engaging than health insurance sometimes is. They have a lot of videos. As you can see, it's definitely built for a diverse audience. They have nice diversity across the characters that are included, and it's really helpful information across that top. You can see health insurance, getting enrolled, using your health insurance, getting medical care. So this is a really fun resource for finding videos on these topics, and I'd recommend checking it out if you want to go for that angle. And obviously videos, when we're thinking about health insurance literacy, those are really helpful because not everyone, even if they are native English speakers, reading information may be challenging. It may be written at a difficult to understand level, but it's really hard sometimes with health insurance information to make it understandable. Like you just can't get around co-insurance, copay. Those words are just, you have to read them when you're reading about health insurance. So sometimes watching a video can help because it's a little more engaging and doesn't require the same literacy demands that a written explanation is going to. So again, this is a little more in depth about this Ensuring Good Health resource. You can see the little comics and videos and the different kinds of information, like that enrollment process one in the lower right-hand corner. That could be a really great one to point someone to if they just say, I don't know how this works. Can you help me walk through it? This is a really fun one to check out. This is a resource on a dictionary of health insurance terms. It's called Just Plain Clear. I will say it is made by a health insurance company. It's made by United Health Group. So when I heard about it, I was like, well, that sounds interesting, but I just really need to vet it carefully since it is from an insurance company. But I've looked through it pretty closely, navigated it, looked through all the pieces, and I don't see any advertisements on it. It never points you to, okay, now that you've read this, sign up for one of our health insurance plans. It doesn't even point to examples from their health insurance company. So I don't see it as a marketing tool for them necessarily. I don't think that you have to worry too much about bias in this resource, even though it is a .com and made by a health insurance company. I think it's a really great place to go if you just need a plain, clear language definition of health insurance terms. And as you can see in the upper right-hand corner, it's available in English, Spanish, and Portuguese. So depending on the populations that you're working with, this may be really helpful too for getting different language definitions. And it's not, Google Translate going through, it's actually written in those languages. And as you can see in that kind of right above the search bar, you can search by word, but you can also browse by letter if you're not quite sure how to spell something. This is an example, the definition they provide of deductible. And you can see here, pretty clear explanation. It hyperlinks to related terms, and then it gives that really helpful example of what this looks like, what a deductible looks like in practice. As you can see, again, no advertisements, so I think it's a pretty good resource. And there on the right, you can immediately change to Spanish or Portuguese for accessing those definitions. This resource, My Health, My Voice, was created in part by the Robert Wood Johnson Foundation, which does a lot of health outreach. And it was specifically made for newly insured women who were having trouble using their health insurance. They were newly enrolled, never had health insurance before, and just didn't quite know how to use it. Again, it was designed with women in mind. I think it is a very universal resource. I don't think it has to be limited to that population, but that's what the goal was when it was created. And it has a lot of really helpful resources, like a step-by-step guide to using it wisely, the 4 kinds of costs you might pay, what is a well woman visit, and even has a personal health journal, all available in English and Spanish. So I find it a really helpful, clear discussion of health insurance. They even have some sample dialogues. I think it's the one with the well woman visit. It's like, this is what it'll look like when you call to make an appointment with your doctor. You'll say this, they'll probably say something like this, then you can say this, then they'll probably say something like this. I think that's so helpful because making phone calls can be really intimidating. You might not be exactly sure, what are they going to ask me? What do I need to know? And so seeing a sample conversation could be really helpful. And they even have these little widgets. So these can also be things that you could include as posts in social media or things on your library website. As you can see, it's pretty clearly described and eye-catching. And then one other resource I want to make sure to highlight that's similar, it's from Coverage to Care, and this was developed by the Centers for Medicare and Medicaid Services. And they use a roadmap to health analogy to walk through all the steps needed from the beginning through getting the health insurance, through using it, that you might need to know to effectively choose and use health insurance. This is a really common one. I've even seen this like on a booth at Walmart, they'll have people passing this out. I saw it there myself. So I think it's a really cool, well-designed resource. It actually came out of a library collaboration. One of the people that I interviewed for the study about people who gotten the PLA funding was actually partnering with a community organization in New Jersey, and they said, we need something like this. And so they helped develop it. So I thought that was really cool that it came out of a library and community organization collaboration. But that's another great tool. Both of these examples that I've shown are available either in print. You can either order copies and have them mailed to your library, or you can just print them yourself, depending on which one makes more sense for your library. But those could be really helpful to just have have available, that could help walk people through health insurance. And again, as I mentioned, sometimes the written material isn't as helpful. So from Coverage to Care, that one from Centers for Medicare and Medicaid Services, they actually have videos for all of these pieces as well. And again, they're in English and in Spanish, and videos are really helpful for people for whom reading the information may be too difficult, may not be as easy to understand. And so this one, for example, is Finding a Provider, kind of gives examples about where can I find names. And then I love that it even includes word of mouth, find reviews online, empowering people to say, I don't have to go with the first doctor that I'm given, I can pick the one that makes the most sense for me. And if you're interested in multimedia type resources, there's also the Juntos Radio, which is from the University of Kansas. It's actually a podcast on health issues that can be downloaded in any number of podcast formats, wherever people might find their podcasts. So again, very helpful for finding health information outside of written information. And this is all in Spanish. So if you have a big Spanish population in your community, this could be a great place to go and check out some additional resources that is audio instead of having people read it. Okay, I promise I just have a couple more, but I want to make sure to leave you with some good takeaway resources that you can rely on at your library. And again, feel free, I see a couple messages about sending the slides. I'm happy to do that. Feel free to send me an email if you want to follow up as well. This is from AHRQ, the Agency for Healthcare Research and Quality, and they have some really helpful resources for getting ready for that appointment. Okay, now I have health insurance. What am I going to do with it? So questions to ask before, during, and after your appointment, and you can even build your own list of questions. Again, I think this is designed to empower people to make the most of those healthcare conversations, not just go in and just let it happen to you, but make sure you've come in with the questions that you want to ask. So I think that's helpful to get people ready for that appointment. And they might be asked to prepare a family history. That I'm sure many of you have had to do this yourself, not all of you. It can be a little overwhelming if it's the first time you've had to do that. So My Health, My Voice, one of the ones I shared earlier, they actually have a template that you can print out. And so you could collect this information in advance. So if it's not something you immediately have in your mind, you can spend some time calling your mom, dad, whoever might be appropriate, filling it out. So this could be another helpful resource to make people aware of. And I always have to make a plug for Medline Plus. It's such a great health information resource, written at a 6th grade reading level or less, available completely in Spanish by just clicking Espanol in the upper right-hand corner. And they do have a page on health insurance. So if you want easy to understand resources on health insurance, Medline Plus is another great place to go. And then lastly, this is a fairly new resource called outtoenroll.org, and it's specifically looking at helping people who are in the LGBTQ community sign up for health insurance. So if you want to do outreach for particular populations, this might be a resource to consider having in your toolbox as well. So I, again, kind of did a blitz tour of a lot of resources, but I want to include a list there to kind of remind you of some of the ones that I shared with you. I'll have a link here in a minute so that you can look at those resources. But I've personally vetted all of them, think that they're helpful depending on what your need and your goal is for providing information. But I hope that at least one in there caught your attention and that you might explore it further. So my goal is that you're feeling a little more empowered to provide health insurance information to address health insurance literacy issues in your community. I think this is a really exciting opportunity for librarians, and I would love to hear from you what's worked well for you, what questions that you have. That is the end of my presentation. I wanted to make sure to leave time to hear from the audience. If you have questions, feel free to add them to the chat or to unmute yourself and ask. That is my contact information, and that URL there will lead you to slideshare.net, which will have a presentation of this material. So I'll have those links there at the end. But again, feel free to send me an email. I'm happy to share my slides with you and answer additional questions that you might have. Thank you so much for your time today, and I'll take time for questions. Thanks so much for the positive feedback in the chat. I appreciate it. I'm glad to hear the resources are helpful. So Has is asking about why open enrollment is only a short period each year. That is such a good question. I think, and it depends on how the health insurance is run. A lot of health insurance is run on a calendar year. So they want you to sign up and get ready for that new calendar year. And the way health insurance works is it pools everybody's risks. So you'll have some people that are healthier, some people that are not as healthy, some people that are younger, older, have chronic conditions, don't have chronic conditions. So they're all in this big pool, and that's how health insurance works, is we sort of all kind of cancel each other out. So I think they have people sign up at a certain time so that then the new year starts and everybody's in this pot all together. And if people sign up at different times, then the pot would be a little bit confused. Like you might wait to sign up. Oh, I just got this diagnosis. Now I need to sign up for health insurance. And so the kind of seesaw of the risk pool would be a little bit off. So that's probably my guess in terms of the actual health insurance companies that are having to make these financial choices. It makes more sense to have everybody sign up at the same time so that you're pooling the risk all together. In terms of like an employer kind of a company, it's a lot of time the human resource officers have to take to train people on the new changes, get people signed up, help them to work through it, answer questions. So if they have it at the same time, then they can do all this kind of outreach in the company at once and then go back to doing their other things the other time of the year. But that's my guess mainly, is that it just kind of works administratively. But again, like I mentioned, there are the special enrollment periods. So if you change jobs, if you get married, if you get divorced, if you have a child, if you're widowed, all that kind of thing, you are in a special exception. And so you can sign up outside of that, but it wouldn't be like I said, oh, I just got diagnosed with this particular cancer. Now I need to sign up for health insurance. You can't do that, probably because of the risk pool. I don't defend health insurance companies, but they have to be, they have to keep running. They have to make their money, I guess. So that's probably their viewpoint on that. Yeah, and Margie says it could discourage insurance hopping as well. Definitely. So that's one thing that's interesting about health insurance right now, is they're really pushing people to high deductible health plans. You may be on one yourself. So it costs less per month, but you have this big deductible that you have to meet before your health insurance actually kicks in. That's cheaper for the company. That's cheaper for the health insurance company. Not necessarily cheaper for you. And you might decide, oh, I shouldn't have picked that. I should have picked this other one. Well, you can't do that until the next year. So you can't hop around based on, I didn't like this one, or again, I got diagnosed with something, I got into a major accident, I should have been under this one. And I don't want to say the high deductible health plans aren't the best choice. For many people, that makes the most sense. They often come with those health savings accounts, but I do think they demand more health insurance literacy skills. So people who are pretty good at navigating finances, navigating the healthcare system, they're probably fine on those plans and can make them work for them. People who are not quite as savvy with the health insurance system, aren't as good with numbers, it could be difficult for them to figure out exactly how to make it work. And that's a big push for my research, is I want to help more people understand it so that they can save themselves money, be healthier in the long term. But that's kind of a big push right now in health insurance, is putting a lot more on the consumer. And sometimes for, like I said, the savvy consumer, they're saving money. For the not so savvy consumer, they could be losing money. And then you have those health disparities be even more increased, that people who can really navigate it well are going to do better in the long term. So, oh yeah, I see Tina says there's usually a number of additional IT people hired. Yes, I'm sure more servers, more IT people to make sure the enrollment websites are working, answer questions. So probably more payroll during that time, and they have to, again, budget for that. And then I see Grace Wright. Is there a place where you would have a summary of each healthcare company? I can't think of one that would be just general. I know in the health insurance marketplace, that's where you can go and compare plans, and they'll group them like bronze, silver, gold, and they will have a bunch of different companies, and you can compare their offerings there. So that would be for someone who does not have health insurance through their employer, they could go in and compare. But you can also do that yourself. I mean, you can just input some of your information and see that those charts. So that is probably the #1 place I can think that you could go and compare health insurance companies. These are great questions. Anything else that comes to mind? Yes, so you can connect with me via LinkedIn. I'm there. I put my Twitter handle here because I tweeted out some of these resources too, so you can kind of look through my tweets, and I've tweeted out presentations about this that you can take a look at. Find me on LinkedIn. And then of course, you could feel free to email me at evardell@emporia.edu, and I'm happy to send my slides or answer questions. I think this is an area we can really provide much needed information. As I mentioned, a lot of times we think about signing up for health insurance, but we can also think about using it. And I think one of the important things to keep in mind with health insurance literacy is you can't make conclusions about who's got good health insurance literacy and who doesn't. When I tell people I study this, most people are like, I don't know anything about health insurance. So if that's how you feel, you're not alone. And so in fact, in my dissertation, the people that I interviewed, the more education they had, the lower levels of health insurance literacy they had. So it was in fact the people with less education knew more, and it was in fact because many of them had worked like as a receptionist at a doctor's office, and so they kind of knew how health insurance worked. So I don't make any definitive conclusions from that, but I think it's important to note that it's not easy to say, oh, they're going to get it and they're not. I think a lot of people need help with this. A lot of people need help with navigating health insurance. And so we can really reach a lot of people by providing helpful resources and helpful information on this topic. Well, if you have any additional questions, like I said, feel free to unmute yourself if you wanted to ask one verbally. Put it in the chat. It looks like we've had most people ask their questions, but I'm here to answer them if anything else comes up. Thank you all so much for attending. I really appreciate your time. I'd love to hear from you. Feel free to reach out, as I've said before. I'm so glad that you all attended, and I wish you all the best with undertaking outreach in this area. Thank you so much. And Grace, yeah, feel free to send me an email for resources for Medicare. I'm actually working on a chapter right now for health insurance for older adults. So it's something I'm going to continue working on, and I'm happy to share additional resources with you if you just send me an email. And everyone stay safe and healthy, and have a very happy Thanksgiving if you celebrate, and take care. We really appreciate your time. Thanks for staying connected to SLIM. And I know we have more webinars coming out, so feel free to check those out. Stay tuned to the additional opportunities that we'll have to learn more. Thank you, everyone. Thanks for the kind words.